Dizziness or vertigo due to cervical spine or cervical musculoskeletal issues is not uncommon. Exercises to treat such cervicogenic vertigo or dizziness can be performed at home to help minimize, if not resolve, this problem. Here are 10 exercises to be performed twice a day, beginning with passive range of motion exercises, followed by isometric exercises. Dizziness can be experienced with these exercises. When such vertigo spells happen, stop and wait for symptoms to resolve before resuming the exercises. Over weeks to months, the cervicogenic dizzy symptoms should improve. However, if any pain, tingling, or numbness occurs, stop the exercises and contact your spine specialist for further evaluation and recommendations. So the first exercise we're going to do is called the head shake. You're simply going to turn your head as far as you can comfortably turn it without any strain or pain for 20 repetitions. So this is 3 and 4. We're moving it very slowly, keeping the shoulders down away from the ear, making sure that we're sitting up nice and tall. And you're going to go ahead and do this twice a day, 20 reps each time. The next exercise is the head nod. Simply relax your shoulders, sit up nice and tall, and lift your head up, and then bring your chin down. The only thing that's moving is your neck up and down, making sure that nothing feels sharp or painful. And you're only moving as far as your head can comfortably lift and tilt. You're going to repeat this for 20 repetitions twice a day. Next, you're going to be doing the ear to shoulder. Staying nice and tall, bringing your shoulders back and down. Simply tilt your ear towards one shoulder. You want to make sure that your gaze stays forward and you're not turning your head this way. So keep that gaze forward and simply tilt your neck to the side as far as it can go comfortably, moving slowly and with ease. Make sure there's no pinching, pain, or tight or numbing sensation. Remember, if you feel any signs of dizziness or vertigo, stop until it recovers, then you can continue. Be sure to do this exercise for 20 repetitions twice a day. In order to do the head nod over the shoulder, you simply want to turn your head towards your shoulder, making sure those shoulders are relaxed and you're sitting nice and tall. And from here, you'll take your chin down towards your shoulder and then lift up in a neutral position. Again, down and back up. Do this for 20 repetitions on one side. Then you're going to repeat 20 repetitions on the other side, twice a day. You want to be sure that when you're performing this movement, you are not straining or squeezing your neck. Everything is done in a nice, gentle and controlled motion, only as far as your head feels comfortable turning. So the next exercise are called chin tuck raises. You want to lay on your back in a comfortable and flat position. From here, you want to raise your chin towards your chest. We're going to start by holding for 3 seconds. Then relax. You can start at 3 seconds, building up to 5 seconds, but eventually the goal will be able to hold our chin tucked for 45 seconds. So practice doing this in increments of 3 to 5 seconds every single day until you build up to 45 total seconds. Feel free to repeat this for 3 repetitions twice a day. In order to do the isometric head rotations, we will use our hand to resist the motion. This exercise is going to look like you're not doing anything, but if you're doing it properly, you should feel a little resistance in your hand and engagement through your neck muscles. To begin, start by bringing your hand next to the temple of your head. What we're doing with this hand is we're keeping the head from actually turning or rotating towards the shoulder, like this. We are doing the head shake motion in one direction, but not allowing the head to turn. This only takes a little bit of gentle pressure and some slight resistance. So bring your hand to your temple like so, and begin to turn your head, but using your hand. Don't let that head turn to the side. We're gonna hold this for 5, 4, 3, 2, 1, then relax. You wanna do this for 3 repetitions on both sides, twice a day. As you can see, it looks like not much is going on, but I feel a lot of pressure between my head and my hand. We're going to do the same isometric head rotation, but at the end range. So rather than starting from the center in a neutral position like this, you're going to turn your head all the way over your shoulder as far as is comfortable. And we're going to take that same hand in the direction of your head turn, place it on the outside of your head just like this, and continue to try to turn the head into it without letting it rotate any further. So it's going to look like this. I'm going to hold it for 5, 4, 3, 2, and 1, then release. Go ahead and repeat again for 3 repetitions on both sides, twice a day. The next exercise is isometric ear to shoulder. So just like the isometric head rotations, we're bringing our hand to our head and applying pressure so the head does not move. It stays in a neutral position. The only difference is instead of rotating our head, we're resisting our head from tilting ear towards the shoulder. So you're going to bring that hand up, start to tilt your head down in this direction, but apply enough resistance that the head doesn't move for 5, 4, 3, 2, 1. Good. Release. We're going to do that for 3 repetitions on both sides, twice a day. We're going to do that same isometric ear to shoulder, but at the end range of the movement. So beginning with your ear to shoulder, bring that hand up to your head and begin to press the head down into the hand as the hand provides resistance. So the head does not move. It stays in this position for 5, 4, 3, 2, 1. Release and relax, then repeat again 3 times per side, twice a day. The last exercise you're going to do is an isometric back head bend. So you're going to take your hands behind your head like this. You feel free to clasp your fingers, but basket them into the back of your head. Now what you're going to do is you're going to be lifting the chin up, tilting that head back into your hands. But because this is isometric, our hands held here resist the head from allowing it to go backwards. So you're feeling that pressure into your hands. You feel your neck contracting towards the back of your neck, and you're holding this for 5 seconds before releasing and then repeating 3 times. You're going to do this 3 times, twice a day. I'm going to go ahead and do one more on this side just so you can see from both sides. Just an extra rep here. In order to gain maximum benefit from these exercises, try to perform at least twice a day. To reiterate, if any pain, tingling, or numbness occurs while performing these exercises, stop immediately and contact your spine specialist for further evaluation and recommendations.